Andrew, you gotta give me something, man. I'm heartbroken, my heart hurts, I'm having chest pains, I feel like I'm gonna get a heart attack, you know? I'm heartbroken, she left me. You gotta give me something, Andrew.
I got it.
Just help me out, you know? Tinder.
Hey guys, Nick Drossos.
Dr. Andrew Steinberg, and we brought back with us Dr. Elroy Shooker.
And welcome to another episode of
Have the balls to talk about it.
That's right. Today we're going to talk about the heart.
Valentine's Day. And we brought back Dr. Shooker to tell us about the heart.
Yeah.
So
for the men who are heartbroken.
On Valentine's Day.
On Valentine's Day.
Yeah, that's harsh.
Where the woman told him, I don't love you anymore. I don't want to be with you.
Yeah.
Does it affect the heart? And how?
That's a terrible time to do that. I mean,
well,
you can
medically,
wait a couple.
yeah, medically. But Nick, you've had a lot of heartbreak experience.
Andrew, I told you, don't talk about it yet. I'm not ready.
All right, so
So we're talking about Valentine's Day heartbreak and how that affects the heart. A tough one, obviously, because the secrets of the heart we're not so sure of yet. We know though the physical effects on the heart, and obviously heartbreak is an emotional thing that you feel physically, right? So you can have all of these physical symptoms from heartbreak, right? Crying is physical, and you can have upset stomachs, and people vomit, and people sleep all day and fall into depressions, and they can have pain and just even get worse than that and have some dire consequences on their heart, which could lead to a stress-induced heart attack, for instance.
Does it actually affect the heart or the circulation of the heart?
So it's not technically the heartbreak itself that affects the circulation or the heart physically, but it is the high amount of stress that you're able to create, where you're increasing your blood pressure and all of these different factors in your blood that might actually have systemic effects on your body, and thereby actually cause, as you said, effects on the ability of your heart to contract, or certain blood clots that might already be there that are very, very fragile and might just take off and cause a heart attack or other consequences.
So what can someone do to keep, a healthy heart? I mean, other than obviously
on Valentine's Day and all year round.
Well, first let's avoid getting heartbroken. So we gotta be good to our significant others, obviously, and it's supposed to be a happy time of the year where we kind of celebrate love, or with whoever those significant others might be. But the heart is something that needs to be taken care of for many, many years, not only on that one day. And usually people wake up to start taking care of themselves and their physical health a little bit too late. Yeah. I have a lot of my patients that actually start taking care of themselves once they get a diagnosis of some sort of chronic disease, whether it is a heart attack,
high blood pressure,
stroke,
diabetes.
If it started with that simple, that would be incredible, right? I mean, you see people coming in with just admitted to hospitals with really harsh diagnoses of, COPD and heart disease and really long-term effects, where now they're not only trying to prevent, but they're trying not to deteriorate. Right? And that's, it's not too late, because it's never too late.
Don't wait for the warning.
100%.
Don't wait for the warning call.
And so you're asking, when should you start? I mean, the best real parents are the ones that actually start with their kids young, right? The ones that go to the gym and go hiking and go on physical trips in order to ingrain, eat well, exactly, ingrain that healthy living in their children, so that they can start, at a very young age. But definitely sometime in your 20s and your 30s, you should definitely start eating healthy. We're all allowed to cheat once in a while. This is all a matter of balance in life.
point.
No one is saying that you should just eat salads all day or gluten-free that you hear about, or doing some detox, some juice detox.
Yeah.
We're talking about a balance. And in that balance, and obviously, Nick, you know that part of the balance is actually working out, whether it's for 20 minutes, 3 times a week, anything more than you being at your desk all day long and just eating junk food or coming home and being so tired to even do anything. Part of the reason why we're so tired is because of that unhealthy living.
When we think of the heart, like would you say is it the engine of the entire body?
100%. So the heart is considered the engine of the entire body, because without it, obviously, the whole car kind of breaks down. It is what pumps blood and oxygen to every single organ in your body, whether it's your liver,
Including your
your
penis.
brain, including your penis, 100%. And you know what? I think at one of your talks, you were talking about erectile dysfunction and how the heart is one of the primary causes of that.
Yeah, heart disease is a huge risk factor for erectile dysfunction. And the opposite, people who have erectile dysfunction are usually more at risk for having heart disease.
Right.
Very, very similar.
So it's correlated. And
Yeah, because if you have bad blood vessels going to the heart, chances are you have bad blood vessels going to the penis.
And that is true for everywhere in your body, your kidneys as well, your brain, your toes, your
Everything.
your
So
brain.
so if you don't care about eating well and exercising because of your heart, do it for your penis.
Suddenly you got everybody's attention.
Yes. What penis?
So and we talk about keeping the heart healthy, obviously eat well, exercise, anything else?
Yeah, so I'm a family doctor, right, by training. So my job is preventative medicine, and unlike Dr. Steinberg over here, I kind of see these patients before they get to the point of disease. And those are the patients that I'm trying to avoid having to see Dr. Steinberg. That said, like any machine, like any good car, right? The engine sometimes breaks and you need to change the oil, or you need to do some maintenance every so often. And at that point, I do refer to the specialist. But if I'm able to prevent a heart attack at the age of 60 and have it at the age of 80, 90, 100, then I'm not looking for recognition of that, but I'm saying like, hey, we did a great job, right? We have statistics and we know what the age of onset of heart disease is, or the average age. And if we can avoid that and have a healthy life for as long as possible with as few complications as possible, then
How big a role does genetics play in heart disease?
huge. Absolutely. Okay. So one of the questions that we ask when we're looking at different scores of what your risk is over the next 10 years of having significant heart disease is whether or not you have a parent or a sibling or a family member that is very close to you, genetically very close to you, that had significant heart disease at a certain age. Usually we're looking at around 50 years old or below.
See, like my dad had a stroke at 55.
So
is that something I should be...
Okay, so now the question goes into whether or not we have certain predispositions to the stroke, right? So you can have certain diseases that lead to the stroke, whether it's heart disease like atrial fibrillation that increases your clots, or diabetes. Yeah. So different things are going to increase your risk of the heart disease and the stroke. So it doesn't necessarily have to be only genetic or only environmental. Okay. There are different factors that are involved. But definitely when you come to me and you tell me, I have a heart disease in the family and my father had a stroke at 55, I take that into consideration. Okay. And we actually even so much as double the risk of having heart disease over the next 10 years. So if I calculate according to your cholesterol level and your and your blood pressure, your age, whether you smoke, whether you're on medication, if I take all of this criteria and I put it all onto a chart and I say, okay, you have, for instance, 12% risk of having heart disease, significant heart disease. We're not talking about just having blood pressure, but significant heart disease over the next 10 years. If you tell me that your father had heart disease at 55, I would double that. I would say you're no longer at 12%, you're at 24.
And we've all seen people who are in amazing shape, work out, eat lettuce every day, and still have high cholesterol and high blood pressure.
100%.
That's a genetic factor.
That is, a lot of times it is a genetic factor, absolutely. Yeah. So you do have familial hypercholesterol syndromes, and you do have other causes of heart attacks that are not necessarily just eating healthy and living well does not mean that you're going to prevent it all.
Yeah, that's also a myth also that eating cholesterol leads to high cholesterol level.
Right.
It's such a complex factor, and even those
Smoking
diets.
is the same thing, right?
Yeah.
You see smokers that are 120 years old, and you're like, how did they do it? So smoking is not bad, but that's not how life works, right? Just because
These low carb diets where you eat lots of cholesterol often sometimes can, if you lose weight, can cause you to lower your cholesterol.
Absolutely.
It's counterintuitive, but it's really complex.
And Mediterranean diets are ways that we want to lower cholesterol, and Mediterranean diets have a lot of cholesterol. Olive oil is olives. I mean, anything that is, fish and fried and heroes and and pita and that's does have a lot of cholesterol. It doesn't mean that you're going to prevent it, but there are certain predispositions that we are aware of, and if we go to a family doctor or we go to consult, we're able to kind of stretch that time frame a little bit longer.
Okay, so assuming that we're being checked out regularly and everything's okay, what are the warning signs that I need to see help now?
Wow, that's a tough question. So some of the warning signs that men usually present with are that their wives are worried. Most men come to consult because their wives, push them. You're 52, and we do have certain guidelines that are required to check for, usually starting at the age of 40, right? So we do certain blood tests. We're looking for your cholesterol levels. We're checking your blood pressure. But definitely, blood pressure, for instance, we're talking about the heart mostly. High blood pressure could include headaches as well, could include severe fatigue, could include chest pain, especially when you increase your blood pressure. So if we were talking about Valentine's Day and heartbreak. If you start having pain in your chest and that's not going away.
That's more I meant. What are the signs that you need to seek help? You need to go to the emergency room.
Yeah.
Like you're having a heart event now.
So absolutely.
Your arm is numb, your chest pains.
Right, so we hear about that, right? Your jaw pain, you can have shoulder pain, arm pain, you can have tingling, you can have just palpitations where your heart is beating so fast out of your chest. Your pressure, we say there's this elephant that's crushing your chest. If it's radiating to your back, from your chest to your back, you're really worried at that point as well. But you know what, actually there's so many heart attacks that could be silent, that could be a little bit of indigestion, nausea, just sweating. So if you're worried, if there's something that makes you worried, I mean, we can talk here for hours about the system and how difficult it is, but our jobs as physicians is to recognize those signs and not to take them lightly.
Yeah.
And so if you're worried and you go to the emergency room or you go to the doctor and they just say, no, this is nothing, they usually guarantee they will probably do an electrocardiogram on you. Yeah. And then they will be able to say, okay, whether or not you're going to wait or you're going in right away. But at least you didn't do this life-changing damage, because we talk about heart and we're saying like time is muscle, right? So your heart is a muscle, and the longer you wait, the more muscle you lose.
Okay, we got to wrap things up, but since it's Valentine's Day and since we're talking about heart, one last question.
Yes.
Chocolate.
Yeah.
I love chocolate.
I love it too.
Dark chocolate.
But I have
90%
90% dark chocolate almost every day.
Every day? And look at you. You look like you're in shape.
I love it. 2 squares, 3 squares.
Just 2 squares, not more.
Yeah, that's it.
Well, that's the thing, right? So balance again. White chocolate, I'm not sure is really chocolate. It's mostly just sugar. Okay. But just balance. You wanna eat, eat something, that you love, but don't eat it every single day, and don't eat it way too much, right? So we say like red meat, eat this much once a week. Yeah, sure, but like don't do things by excess. All right, and so if chocolate is what you want to eat on Valentine's Day, that's fine.
Yeah. Make it dark, guys.
Dark chocolate,
90%.
Antioxidants, and there's some studies which show maybe good for you in moderation.
Absolutely.
So happy Valentine's Day.
Happy Valentine's Day.
Hope you guys enjoyed the episode.
Have the heart to talk about it.
Leave us in the comment box question. Make sure to subscribe.
I brought my little friend.
Hit the bell and have
the balls and the heart to talk about it.
Absolutely. All right, I'm already a regular. All right,
I'll introduce you.
Okay.
Okay.
All right.
Ready? Hey guys, Nick Drossos.
Dr. Andrew Steinberg, and today we brought back our favorite guest.
What am I, your favorite one, Andrew?